ഹലോ എവരിവൺ, നമ്മൾ ഇന്ന് 2020 PSC അസിസ്റ്റൻറ്റ് സർജൻ ക്വസ്റ്റ്യൻ പേപ്പറാണ് ഡിസ്കസ് ചെയ്യുന്നത്. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, വിച്ച് ഓഫ് ദ ഫോളോയിങ് മസിൽ ഈസ് സപ്ലൈഡ് ബൈ ആൻറ്റീരിയർ ഇൻട്രോഷ്യസ് നെർവ്? We know that this anterior introitious nerve supplies flexor pollicis longus, lateral half of the flexor digitorum profundus and pronator quadratus. So here the answer is flexor pollicis longus. This extensor pollicis longus is supplied by the radial nerve. Flexor carpi radialis is supplied by the median nerve. And brachialis is supplied by the musculocutaneous nerve. So here the answer is option A. Next question. From which of the following pharyngeal pouches does the thymus develop? Thymus develop from the third pharyngeal pouch. Option C. Next question. The structures passing through the gap between the superior and middle constructor is? The structures passing between skull and superior constructor is pale structures. P is palatine branch of the ascending pharyngeal artery, ascending palatine artery, levator palatine muscle and eustachian tube. Between the superior and middle constructor, the structures are stylopharyngeus muscle and glossopharyngeal nerve. Between the middle and inferior constructor, internal laryngeal nerve and superior laryngeal vessel. Between the lower border of the inferior constructor muscle and esophagus, the structures are recurrent laryngeal nerve and the inferior laryngeal vessels. Here the answer is glossopharyngeal nerve, option A. Option A. Next question. Trapezo-metacarpal joint belong to which of the following types? It is a saddle type of joint. Next question. In which of the following tissue insulin is required for glucose uptake? Okay. GLUT1 is in brain, kidney, placenta and RBC. GLUT2 liver, pancreas and kidney and intestine. GLUT3 brain, kidney and placenta. GLUT4 that is insulin dependent, that is in heart, skeletal muscle, adipose. Next GLUT5 is in small intestine and that is for fructose, and SGLT1 is in small intestine and kidney. Next question, which of the following enzyme is dependent on pyridoxal phosphate? Pyruvate carboxylate, it's a carboxylase. This is depend on B7 carboxylase. Next, pyruvate dehydrogenase, this is thiamine dependent. This is B1. Tyrosinase is copper. Next, ornithine decarboxylase, it is dependent on the pyridoxal phosphatase. So the answer is option B. Next question, enzyme activated by insulin is? Enzyme activated by insulin is lipoprotein lipase. Glucagon will activate this hormone sensitive lipid. This is by glucagon. Okay, insulin will activate lipoprotein lipase. So the answer is option A. High anion gap metabolic acidosis can occur in the following conditions except? High anion gap metabolic acidosis, the mnemonic is mud piles, M methanol metformin, U uremia, DKA paraldehyde, INH lactic acidosis, ethanol salicylate, starvation. Normal anion gap metabolic acidosis, the mnemonic is used car, ureterostigmotostomy, saline infusion, enterocutaneous fistula, diarrhea, carbonic anhydrase inhibitor, adrenal insufficiency and RTA type 4. So the answer is renal tubular acidosis, option D. Next question. A 50-year-old male was admitted in the ward with hemiplegia of the left side, which started as weakness. There is areflexia of upper limb and exaggerated reflex on lower limb on left side. The most probable site of the lesion could be? Here, areflexia of upper limb, that is a element sign, and exaggerated reflexes on lower limb on left side, that is a UMN sign. So, to produce element sign in left upper limb, the lesion must affect lower motor neurons or anterior horn cells or nerve root corresponding to upper limb, that is C5T1. So, here the answer is option B, single lesion at the C5 or C6. If a lesion is at the level of the lesion, there will be element lesion, and below the level there will be UMN lesion. Next question. Select the correct statement regarding hypothyroidism. The answer is reaction time of stress reflex is prolonged. Next, diarrheal symptom in cholera epidemic is due to which of the following changes in the intestinal transport? In cholera, there is labile toxin, so this will increase the intracellular CMP. So this option is correct. So wrong. Option B is also wrong. Option C is also wrong. There is reduction in the NaCl absorption. This secondarily there is a reduction in the NaCl absorption. So the answer is option D. All of the following shift the oxygen dissociation curve to the left except. Left shift means there is increased O2 and there is decreased CO2. So when there is decreased CO2, there will be decreased 2,3 dpg, decreased temperature and increased pH. When the graph is shifted to the right, there is decreased O2, increased CO2, decreased pH, increased 2,3 dpg and increased temperature. Here the answer is option C, increasing 2,3 dpg. That is decreasing 2,3 dpg. Cooling of body after death is known as algar mortis. The triad trademark is an example of membrane abrasion. Commonest cause of impotence in males is vascular disease. Section 174 CRPC deals with inquest. Next question. Western blotting is used for separation of. I'll give a mnemonic. We can write as snow drop. This is southern blotting for DNA, northern blotting for RNA, western blotting for protein. Okay, so here the answer is western blotting is used for protein, option C. Scoring system used for the diagnosis of bacterial vaginosis is Nugent score. Okay, next. Transduction, transformation and conjugations are different methods of gene transfer in bacteria. The infection transmitted by mite is scrub typhus. Okay. Anticoagulant used for osmotic fragility test is heparin. The histological type of carcinoma with bad prognosis is infiltrating duct carcinoma NOS. The microscopic feature of sarcoidosis include or except, it will include epithelial granuloma, asteroid bodies, Schaumann bodies. There is no pesticid necrosis. Minimal change primary glomerular disease is characterized by effacement of the food process of the podocytes. It's podocyte. Okay. Next, which of the following drug is not associated with weight gain? The drug not associated with weight gain is option D, metformin. Exenatide, it is an example of GLP-1 analog. Option A. Anti-tubercular drug associated with optic neuritis is ethambutol. This pyrazinamide will cause gout, isoniazid and rifampicin. There will be, for both rifampicin there is orange color urine and also there is hepatotoxicity. Isoniazid also causes hepatotoxicity. Raltegravir is an integrase inhibitor. Next, prevalence of low birth weight is an indicator of which type of indicator of health? It is a nutritional indicator. Next, the effective vaccine is available against all the following disease except leishmaniasis. Okay. Hidden hunger refers to micronutrient deficiency in the community. Next, Aedes mosquito transmit all of the following disease except. Aedes transmits chikungunya, dengue, lymphatic filariasis, Rift Valley fever, yellow fever, Zika virus. Anopheles will transmit lymphatic filariasis and malaria. Culex will transmit Japanese encephalitis, lymphatic filariasis and West Nile fever. Will transmit all disease except West Nile fever. Next, which of the following is the strongest study design? The strongest study design is the randomized control trial. Which one of the following method is used to estimate chlorine demand of the water? It is Horrocks apparatus. Which protein is considered as reference protein? It is chicken egg. Next, the denominator of maternal mortality ratio is the total number of live birth. Okay. HLA associated with uveitis of Behçet's disease is HLA-B51. All are signs of trachoma except Horner-Trenda spot. This one. Okay, this is feature of VKC. Okay, option B is the incorrect option. Next, corneal endothelial cell count is measured using specular microscope. Okay, keratometer is used for corneal curvature. Pachymeter is used for corneal thickness. Okay, then all other features of central retinal artery occlusion except central stereo spot at the macula. This is correct. Cattle tracking of brain, correct. There is marked massive retinal hemorrhage. This is wrong. There is marked narrowing of the retinal artery. This is correct here. The option except this option C. Okay. Next. Multiple perforation of tympanic membrane is seen in. It is seen in tuberculous otitis media. Okay. Osman's pad of fat is seen in, it is seen in eustachian tube. Okay. Recruitment phenomenon that is seen in cochlear lesion. Here the cochlear lesion seen is Meniere's disease. Meniere's disease is the cochlear disease. Otosclerosis is conductive hearing loss. Acoustic neuroma is retrocochlear. Okay. Then rhinitis medicamentosa is caused by prolonged use of the decongestant nasal drops, which is not a malignant lesion of the oral cavity. This is option D, ranula 45. Next, mucocele is most common in the frontal sinus. Teardrop sign is seen in the blowout fracture orbit. Most common symptom of the nasopharyngeal malignancy is cervical lymph node enlargement. Okay, this nasopharyngeal malignancy that arises from the fossa of Rosenmuller. And the most common symptom is cervical lymph node, jugular lymphadenopathy, cervical lymphadenopathy. Ludwig's angina, it is the infection in which space? It is the infection in the submandibular space. Which most common site of lodgement of foreign body in throat? Most commonly foreign body in throat, it is cricopharynx. It is a cricopharynx. Okay. Next is, it is the most narrowest space. So, most of the foreign bodies get lodged there. A simple measure to assess central obesity is waist-hip ratio. All are diagnostic criteria of diabetic mellitus except fasting blood sugar greater than 126, correct. Postprandial blood sugar greater than 180, wrong. It is greater than 200. Means random blood sugar greater than 200 with symptoms of diabetes mellitus, correct. HbA1c greater than 6.5, correct. So the option is option B. Next, which test is best preferred for screening of vitamin D deficiency? For screening of vitamin deficiency, 25-hydroxycholecalciferol. This is the option C is the best preferred test. Polyvalent anti-snake venom in India is ineffective for envenomation with, it is ineffective for hum-nosed pit viper. This is against the spectacled cobra, common kite, Russell's viper and saw-scaled viper. Okay, so it is not again hum-nosed pit viper. Antidote for paracetamol poisoning is an acetylcysteine NAC, which is not a feature of progressive supranuclear palsy. So option A, extended posture, correct. Tremor minimal, correct. Gaze palsy, correct. Good response to anti-Parkinson drugs, this is wrong. They are less active to this, they are giving less response to this levodopa, which is not an extra articular manifestation of ankylosing spondylitis. Option D, aortic stenosis. Anti-centromere antibodies are positive in Crest syndrome. Not a precipitating cause of hepatic encephalopathy, hyperkalemia. Not a non-specific biochemical abnormality in hyperthyroidism. Here the answer is hypocalcemia. All are non-neurological symptoms of Parkinson's disease except is a hypohidrosis. Stimulus control therapy is related to insomnia. Non-arthritic anterior ischemic optic neuropathy is associated with sildenafil. Lithium when combined with ECT can cause all except neurolytic malignant syndrome. The final active metabolite of diazepam is oxazepam. That is option D. Next, name the test to assess fetal maternal hemorrhage. It is Kluwer-Bethke test. Human placental lactogen, it is produced by syncytiotrophoblasts. Option A. First manifestation of magnesium toxicity is, it is loss of patellar reflex. Closed cells are seen in bacterial vaginosis. Next, Nikolsky sign is positive in staphylococcal scalded skin syndrome. Option D. Impetigo hepatiformis is, it is generalized pustular psoriasis in pregnancy. Option A. An adult male in 5th decade when present with diffuse brown pigmentation over skin with hepatic cirrhosis, diabetes, cardiac failure, arthritis, impotence. He is suffering from. So this is also called bronze diabetes. The condition is hemochromatosis. Okay. Necrolytic malignant erythema, it is strongly associated with. It is strongly associated with glucagonoma. Glucagonoma is option A, alpha cell tumor of the pancreas. Next, regarding the sodium metabolism, the following is not true. Option M, sodium is the principal cation of extracellular fluid. This is correct. Next, 47% of the sodium is in the bone. True. Following trauma, there is variable period of increased sodium excretion. This is false. For up to 48 hours following trauma, there is increased adrenocortical activity. This is correct. So, the incorrect option is option C. Regarding allograft rejection, all are true except immunosuppressive therapy can prevent graft rejection. Correct. Cytotoxic T cells, delayed hypersensitivity, and antibody dependent mechanism all play a role. Correct. ABO blood group antigens are important antigen. Correct. There are unique immunological mechanism causing graft rejection. This is wrong. Option is answer. Option is D. Answer is option D. Most common site of carcinoma lip is vermilion border of the lower lip. It is not upper lip, it is lower lip. Next, the sign of esophageal atresia. It is continuous pouring of saliva from the mouth. Option B. Histamine is produced in the stomach by which of the following cell? It is produced by ECL cell or endochromaffin-like cell. Sunburst periosteal reaction is most commonly seen in osteosarcoma. A characteristic narrowing and calcification of the intervertebral disc in radiograph. It is seen in achronosis. Finster sign is pathognomic of Kienbock disease. Nutcracker is a fracture of cuboid. Cracker cuboid. Okay. Mention is scale to assess spasticity. It is Ashworth scale. Option B. Botulinum toxin act at the level of neuromuscular junction level. Reflex level center for the bladder is situated in the pons. Option A. Normal angle brachial index is 0.8 to 1.3. Which of the following are the genes found to be involved in colorectal carcinoma? It is MLH1 gene on the chromosome 3. In small cell carcinoma of the lung, the usual chemotherapy is cisplatin plus etoposide. Option B. Which of the following is not an aromatase inhibitor? Tamoxifen. It is a estrogen modulator drug. Option A. Other all are aromatase inhibitors. Half-life of cobalt-60 is 1.5 years. Not 1.5 years. It is 5.3 years. Option D. Option D is the correct answer. What is the average photon energy of the most commonly used brachytherapy source? Iridium 192. 91. It is option A. 0.38 MV. Which of the following inhalational anesthetic have the lowest blood gas partition coefficient? The drug is option D, that is nitrous oxide. It has the lowest blood gas partition coefficient. So there was a question, high anion gap. Again, a normal anion gap question is also asked. Okay, I already discussed normal anion gap as metabolic acidosis examples. Okay, here the answer is option C, intestinal obstruction. Other all are high anion gap. An ASAI patient in post-operative recovery room shows pulse oximeter saturation 74%. The corresponding arterial oxygen tension would be, it should be 40 mmHg. The most effective system for spontaneous respiration is this Maplesome A. Features of vitamin D deficiency include all of the following except. We know that white spot, it is vitamin A deficiency. So the answer is option A. Other all are of vitamin D deficiency. Which of the following statement regarding cyclic vomiting are true except its episode will last 2 to 3 years? It is correct. There are 4 or more emesis episodes per hour. Correct. It is a migraine equivalent. Correct. It is associated with nystagmus. False. Option D is the option. Most important extramedullary site of relapse in childhood ALLs. It is central nervous system. Option B. A 7-day-old male infant present with seizure, serum glucose is 70 mg per dl. Examination is normal with the exception of jaundice and microcephalus. The most common likely diagnosis is, it is congenital hypopituitarism. Cause of macrocephaly include all of the following except except congenital CMV infection. So these were the 2020 questions. Thank you guys. Let's revise CMS questions in the next video.